Medicare for All sounds like a great idea, and many leading Democratic candidates support it. But in reality, Medicare for All is bad news for pro-lifers, for those who are the most vulnerable, and for the country in general. As a mother of 4 kids, 2 of whom have high-cost medical needs due to a cystic fibrosis diagnosis, I should be the primary supporter of taxpayer-funded healthcare. But I know that government-run healthcare stifles innovation. It decreases competition and makes it more likely that people like my children will be denied the life-saving healthcare they need. For example, in the United Kingdom, cystic fibrosis drugs that my kids have been taking for years were just recently approved, even though the drugs have been selling in the US market for years. I don't trust a bureaucrat to ensure that my children receive health care. I don't trust a panel of ethicists or scientists to decide that my kids deserve health care. Similar panels and ethicists in the United Kingdom decided that children like Charlie Gard and Alfie Evans should die because their nationalized health care service didn't want to let anyone else try to treat them. That's just one reason why, as a pro-lifer and as a mother of 4 children, I don't want Medicare for All. Medicare for All is also a massive giveaway to abortion vendors like Planned Parenthood. Right now, Planned Parenthood brings in $616 million in taxpayer funding, according to their latest report. Since Planned Parenthood right now only treats 16% of the STDs it diagnoses. Having Planned Parenthood run healthcare would be as effective as having the government run healthcare. What we do know for a fact is that if Planned Parenthood runs healthcare, abortions will increase. The more money Planned Parenthood receives from taxpayers, the more abortions they commit. For example, in the year 2000, Planned Parenthood committed a little over 150,000 abortions. They received a little over 100 million taxpayer dollars. In 2019, they committed over 340,000 abortions with over 600 million taxpayer dollars. They've gone from committing 15% of all abortions in the United States in 2000 to 40% in 2019. And the funny thing is that all these candidates rail about removing corporations from politics and emphasize the negative effects of corporate money in our democratic republic sure don't seem to mind taking money from Planned Parenthood and then giving them money in return. We know that Medicare for All means increased funding for abortions and for Planned Parenthood. Medicare for All is bad for healthcare innovation. It's bad for the preborn. It's bad for those who are the most vulnerable. But it is good for Planned Parenthood's bottom line.